Well, it's 12:03, and as promised, we're going to go ahead and get started. Welcome to the Hennepin-University Partnership Webinar Series. Today's webinar is titled Cannabis in Minnesota: Legalization, Research, and Implications, and is presented by Dr. Tracy Toomey and the Cannabis Research Center team. My name is Amy Delahanty, and I'm the director of the Hennepin University Partnership. The Hennepin University Partnership, or HUP, is a collaboration between Minnesota's most populous county and its only land-grant university. Here at HUP, we're dedicated to catalyzing and supporting mutually beneficial relationships. The partnership has led to over 500 joint projects, combining academic research and local expertise to inform policy and practice for the benefit of Hennepin County residents. The goals of this webinar series are to disseminate knowledge, showcase expertise, and help facilitate future cross-institutional collaborations. While this webinar was designed with primarily a Hennepin County audience in mind, it's also open to the public and our university partners. So a big thank you to everyone from across the state that could join here today. There's about 75 folks of you joining, and it's growing. Before we get started, just a few Zoom reminders for our audience. Your video, audio, and chat are not enabled. If you need any support from the HUP team, please use the Q&A function. If you'd like to ask a question, you can submit that through the Q&A function at any time, and there'll be about 15 minutes at the end of this presentation to answer any questions that come up. We'll monitor questions throughout and save time, as I said, to address them at the end. This webinar, as you can see, is being recorded. So please look for an email from hup@umn.edu with a survey and a link to the recorded webinar video tomorrow. And finally, we are so glad to welcome and introduce our presenters from the Cannabis Research Center. The University of Minnesota School of Public Health's Cannabis Research Center, or CRC, was established in 2023, shortly after Minnesota legalized adult use cannabis. The CRC strives to understand the health implications of cannabis and to be a trusted source of information to guide policy and practice related to cannabis use. Now, I will turn it over to them for the presentation and some introductions.
Thank you so much. We're so happy to be here today to talk about cannabis in Minnesota. It's something that we think about every single day. And so we're here to, happy to come here today to share a little bit of what we're learning. I'm the director of the Cannabis Research Center, Tracy Toomey. You'll also be hearing from other really key members of the CRC team. You'll hear from Eileen Delahanty, Natalie Schultz, Kathleen Link, and Diana Augustin. And Natalie, if you could advance to the next slide. Just want to give you a quick overview of what we're going to be talking about. I'll just briefly tell you a little bit more about the Cannabis Research Center. I will also provide some highlights of cannabis policies in Minnesota because it affects what's happening and what research we do. I'll highlight a few of the research topics that we're focusing on as part of the CRC. And then you'll hear from the others who will provide some highlights from some of our studies, some of the results from our pseudo underage purchase attempts, from our assessment of hemp business locations and density across Minnesota, results from some of our surveys of the Minnesota State Fair, and results from focus groups with American Indian and African American populations. And then we'll conclude with some information about how we disseminate some of our findings and then some thoughts about looking ahead. Next slide, please. As you already heard, the Cannabis Research Center is housed in the School of Public Health at the University of Minnesota. And so we really focus on public health outcomes. That's our primary focus. And I really want to emphasize that we want to be a trusted source of information. We hope that our information can help guide policy and practice. And we also, hope that we are a good resource for the general public as well. Next slide. We have a whole team. You see a few of us here. I don't have time to walk through everyone, but just to know that we really have a wonderful team that's really dedicated to helping to figure out what's happening around cannabis here in Minnesota from a research perspective. Next slide. So the first thing I want to do is provide a little bit of an overview of the cannabis policy landscape here in Minnesota. There are a number of policies that affect what's happening here in our state. Next slide, please. We first have to go back to about 1970, actually to 1970, when the Federal Comprehensive Drug and Abuse Prevention and Control Act passed. And that made cannabis, at that time called marijuana, but we now call it cannabis, uh, was made a Schedule One drug, which means it has the most restrictions on it of any type of drug. And that's the way it was for many, many years. Now, fast forward to 2014, Minnesota joined other states to legalize cannabis use for medical purposes. And so we developed a small medical cannabis program at that time. Now, move towards 2008, there was again federal legislation that affects what's happening here in Minnesota. As part of the federal farm bill, um, the federal government descheduled hemp, which is a form of cannabis. It has lower amounts of THC, which is the psychoactive property in cannabis. It has lower amounts. It was kind of bred for use for agricultural purposes or industrial purposes. With that descheduling, it created a loophole, however, where it enabled people to extract THC from the hemp plant and to insert it into products such as the gummies and the seltzers. So since 2018, I think there were producers learning how to create those kind of products. And you hear about Delta 8, Delta 9, Delta 10. It's playing out a little differently across different states in the US. In Minnesota in 2022, you might have thought that's when you first heard Minnesota legalized cannabis. Well, in fact, what happened in 2022 in Minnesota was the Minnesota legislature put some restrictions on these hemp-derived THC products. So established an age limit, packaging restrictions. Those restrictions are not in place in every state in the US. Then in 2023, of course, is when the full legalization happened in Minnesota so adult use cannabis was legalized. And as you already heard, that is when the appropriation occurred to develop the Cannabis Research Center at the University of Minnesota. Since 2023, we've been developing the Cannabis Research Center, and the state has been figuring out how to implement the legalization process. And I know it affects state agencies, but also many local agencies and institutions within Hennepin County. And then now in 2020, now we're in 2026, but at the end of 2025, there are also two other types of changes that occurred that we're not sure how it will affect what happens in Minnesota, but just want everyone to be aware that when the federal government shut down in the fall, and the bill that reopened the government included, it was languages inserted to effectively ban the hemp-derived THC products, but not until fall of 2026. Things could change. There's people advocating for changes, but that's where we're currently at. Also, President Trump signed an executive order to reschedule marijuana from Schedule One, which is the most restrictive category, to Schedule Three, and that process had started during the Biden administration, but with the executive order, it was encouragement to move that process along. It's not a certain outcome, but it may affect things with businesses, but also what type of research can be conducted. Next slide. There are many challenges to doing research around cannabis. One is the Schedule One status. The other is that there's these multiple overlapping policy changes, which makes it hard to kind of detect specific effects of specific policies. There's this long implementation process with the rollout, and you'll hear about some of that. There's limited existing data sources, and there's many different products and methods of cannabis use, which makes it more complicated to study. And it's just really a rapidly changing environment. Next slide, please. Some of the work that we did right from the very beginning was to try to improve the data sources. As I said, it was very limited. So we've done work working with state agencies to add cannabis questions or improve the cannabis questions, including on the BRFSS, the University of Minnesota College Student Survey, the Minnesota Student Survey, as well as PRAMS, which is the Pregnancy Risk Assessment Monitoring System. We're also have been developing new data sources, and you'll hear about some of that work. Next slide. we put an emphasis on public engagement and equity means many different things, including looking at urban-rural differences, looking at racial inequities, just making sure that we're integrating an equity approach within our questions as well as how we're approaching all of our research. Next slide. Our core community CRC research covers a range of different topics, including looking at implementation, for example, looking at what school support staff, what kind of training and technical assistance do they need to address cannabis use in the schools? Compliance, are establishments complying with the laws? Looking at the prevalence of use of different cannabis products, looking at whether, how many people are using during work or while driving, looking at potential benefits and also potential consequences of use. Ultimately, we want to look at the effects of legalization on a variety of health outcomes. We're factoring in differences of effects across groups. And again, we're taking this equity focus. Next slide. We do this core research, but we're also funding other researchers with different expertise across the university. We have a small grants program and have already made grant awards to other faculty members in the School of Public Health, in the School of Pharmacy, the Medical School, the Humphrey School, Biologic Sciences, and Plant and Microbiology. So we hope through this funding mechanism to answer even more research questions outside of our core expertise. Next slide. Next, I'm going to start, we're going to hand off to different speakers in the group. You're going to get just a brief overview of just a few of the studies that I've already mentioned. And so next slide. You're going to first hear from Eileen Delahanty, and then each of the other speakers will introduce themselves as we hand it off to each other. Thank you.
Thanks, Tracy. Hi, everybody. I am Eileen Delahanty. I've been with the CRC since it started, and I'm going to be talking today about our study looking at pseudo underage purchase attempts in both Hennepin and Ramsey County. Next slide, please, Natalie. So Tracy went over the timeline of cannabis policies here in Minnesota. This study was conducted last summer, so in 2024, and this was really after Minnesota had legalized non-medical adult use cannabis, but before any of this hemp was redefined by the federal government, and really before we saw dispensaries here in Minnesota. So we were really specifically looking at the hemp-derived THC products and how easy it is for underage people to access it. Next slide, please, Natalie. So our research question here, how likely is it that underage people can buy hemp-derived THC products in a relatively unrestricted marketplace? As Tracy talked about, in Minnesota, there are some rules and regulations around these hemp-derived THC products, and one of them is that you have to be 21 in order to purchase it. Other states don't have this. Here in Minnesota, we do, and we wanted to see, are establishments likely to follow this, or could people that look like they're underage actually be able to go in and purchase these products without identification? Next slide. In addition, we wanted to look at different discrepancies or different types of establishments. So we looked at on versus off-premise establishments. On-premise being places that you would consume on site, like bars, breweries, restaurants. Off-premise places that you would take the product with you and consume it later, like grocery stores, convenience stores. Age-restricted versus not age-restricted establishments. So age-restricted establishments we defined as places that primarily sell age-restricted products. So liquor store, tobacco store, and bar would be examples of that. And not age-restricted would be places like convenience stores or restaurants. Those places might still sell other types of age-restricted products like alcohol and tobacco, but that's not their primary source of income. And finally, we wanted to look at cities versus suburbs. So the cities that we looked at were Minneapolis and St. Paul proper. The suburbs that we looked at were Hennepin County excluding Minneapolis and Ramsey County excluding St. Paul. Next slide, please. So in order to do this, we conducted pseudo underage purchase attempts. Now we have been conducting these for alcohol for some time, and and recently started doing this for cannabis, or for hemp-derived THC, I should say specifically. And in doing this, we hire people that are over 21, but are judged by a panel to look under 21. We're really looking for people in that 18 to 20-year-old age range. We have them go to establishments and attempt to purchase these hemp-derived THC products without their identification. So, and if an establishment tries to ID them, they say they left it in the car. And this gives us an indication of the purchase rate to actual underage people. Next slide. So our sampling frame, as I said before, we're Hennepin and Ramsey counties, and we selected all of the establishments that were on the Minnesota Department of Health hemp-derived or hemp THC registry, about 1,500 of those establishments, and we randomized those by the location and type of establishment. Next slide. We categorized each establishment by their location, whether or not they were on or off premise, and whether or not they were age restricted or not age restricted. And so in the end, we had a stratified random sample by these 3 different characteristics. Next slide. Overall, we completed 293 purchase attempts, again, across Hennepin and Ramsey County. And next slide, we found that the overall sales rate to our pseudo underage buyer was 34%. Next slide. When we look at differences, next slide, between on versus off, again, on premise, consume on site, off premise, you take the product with you. Next slide. We see really no difference. So we were able to conduct 110 purchase attempts on premise, 183 off, the purchase rate of 35% on premise and 33% off premise. Next slide. Really showing that on-premise establishments were not more likely than off-premise establishments to sell to our pseudo underage buyer. Next slide. When we look at age restricted versus not age restricted, again, age restricted we define as bar, brewery, bar, brewery, tobacco shop, liquor store, and hemp dispensary. Not age restricted were places like grocery store, gas station, and restaurant. Next slide. And here we see a substantial difference. So 182 purchase attempts at the age restricted stores. Again, perhaps unsurprisingly that there were more locations there. 111 purchase attempts at the not age restricted stores. And it was the not age restricted stores that had a higher sales rate to our pseudo underage buyer than our age restricted stores. Next slide. And our conclusion here was that the not age-restricted establishments were more likely than age-restricted establishments to sell to a pseudo-underage buyer. And we looked at this statistically as well. So we did multivariate adjustments and found that even after adjusting for a variety of factors, there were differences between the two. Next slide, please. Finally, cities versus suburbs. Again, cities were defined as Minneapolis-St. Paul proper, suburbs, Hennepin County excluding Minneapolis, and Ramsey County excluding St. Paul. Next slide. There were 170 purchase attempts in Minneapolis and St. Paul, 123 purchase attempts in Hennepin and Ramsey County. And we see that the cities had a higher sales rate than our suburbs. Next slide. Suggesting that the cities, establishments in the cities were more likely than establishments in suburbs to sell to our pseudo underage buyer. I will say here very quickly that our city sales rate between Minneapolis and St. Paul was very similar. We did find a difference between looking at Hennepin versus Ramsey County. Ramsey County had a very low sales rate, and Hennepin County was really between Minneapolis and St. Paul and Ramsey counties. Next slide, please. So our next steps, we plan on publish and present these findings as we're doing now. We have started and are looking at pseudo underage purchase attempts across Minnesota. So one of the things that we're very interested in at the CRC is not just looking at Hennepin and Ramsey County, but really looking at greater Minnesota and what does it look like there. So we've been looking at that. We also have been working with local public health and state on best practices to reduce underage access, including with reviewing compliance checks. We don't conduct the compliance checks, but we are looking with other stakeholders at potential effects of compliance checks. Next slide, please. Okay, with that, I'm going to pass it to Natalie.
Thank you, Eileen. My name is Natalie Scholes, and I'm a research fellow at the Cannabis Research Center, and I've also been with the Cannabis Research Center since it began in 2023. And I'm going to be presenting on proximity to hemp-derived cannabis retail locations in Minnesota, but mainly we're going to be focusing on the Twin Cities metro area. My project team included Eileen and Darren Erickson and Dave Van Riper. So I have a timeline here that kind of gives some background on the registration and licensing of hemp retailers in Minnesota. So when adult use cannabis was legalized in August of 2023, hemp retailers were required to register with the state of Minnesota as well at that time with no fee by October 1st of that year. And then this list was compiled by the state and put on the Department of Health's website and eventually over to OPCM, and we have been downloading it and using it for research. And then in April of 2025, this old registration system closed. And last summer, a new registration window opened for unregistered hemp retailers along with a cannabis licensing process to allow any hemp retailers that were unregistered to register. And then last fall, registered hemp retailers that were in good standing could convert their registration into a hemp retail license. So it transferred from a registration system over to a licensing system last fall. The application fee was $250 and the licensing fee was an additional $250. And the list of licensed hemp retailers and cannabis licensed retailers are now available online on OCM's website. So proximity to hemp retailers, why is this important? There's some evidence in the literature that greater access to cannabis outlets has been linked to increased cannabis use, lower perceived health risks of cannabis use, and health inequities. There are also possible public health benefits with greater access, but more research is needed. So the research questions for this study were, what is the average distance to a hemp-derived cannabis retailer for Minnesotans living in the 7-county Twin Cities metro area? And what demographic and geographic characteristics are related to distance to a hemp-derived cannabis retailer in the 7-county Twin Cities metro? So the methods that we used for this study. Data sources included the old version of the Minnesota Registry of Hemp-Derived Cannabis Retailers. And then we linked it with census block level demographic characteristics and census block group level geographic characteristics. As we worked with the Minnesota Registry of Hemp Retailers, we realized that some of the addresses on the list were actual residences and not retail locations. And because of this, we decided to do some data cleaning and had to use the Metro GIS parcel data to remove residences to ensure that our list was true, like hemp retailers. So we had to limit our data to the 7-county metro area because of that. So after we did some data cleaning, we geocoded and spatially joined the data. And then we calculated the distance from each metro block centroid to the nearest hemp-derived cannabis retailer. So these shapes up here kind of show like each of the shapes sort of represents a block. The black dot is sort of the centroid and the H's are hemp retailers. So we just calculated the distance from that centroid to the nearest hemp retailer for each block. Then we created a population-weighted distance average in kilometers for each block group in the metro area. And there were 2,600 of these. Then we compared distance categories across geographic characteristics, rural and urban, demographic characteristics, sex, age, race, ethnicity, and median household income. And I won't be able to show you all of these today, but I'll show you a few of them. So first of all, this is a map that shows the 7-county metro area, and each green dot represents a hemp retailer. So you can see like around the perimeter of the 7-county metro area, they're pretty sparsely located. And as you move in toward the center, toward Minneapolis and St. Paul, they become more dense. So overall, the average distance in the 7-county metro area to the nearest hemp retailer was 1.1 kilometer. In metro urban areas, it was 0.8 kilometers on average, and in rural areas in the metro, it was 2.9 kilometers. So this shows a chloropleth map, and it breaks down the distance, the block groups into 4 distance categories. less than 0.5 kilometers, 0.5 to 1 kilometers, 1 to 3, and 3 or more kilometers. The lightest blue represents that shortest distance group, and then as you get to darker blue, it's a longer distance. And you can see, looking at that 7-county metro area map, the darker block groups are located in the perimeter, and as you move in toward the center, the block groups are lighter color and closer distance to a hemp retailer. Now we'll look at some of those demographic characteristics. So these are those 4 distance categories again on the left, and then we have average percent of different age categories represented by the different colors. So less than 24, 25 to 49, 50 to 64, and 65 plus. So you can see in the shorter distant categories, we have a higher percentage of people aged 25 to 49. And in the farther distant categories, 3 or more kilometers and 1 to 3 kilometers, we have a higher percentage of 50 to 64-year-olds. And then looking at race by the hemp retail distance categories, we see a higher percentage of white alone in the farther distance to a hemp retailer category, 88%. Compared to some of those closer distance groups, which are 61%, 68%. And then the closer distance to a hemp retailer categories had higher percentages of Black alone, American Indian alone, Asian alone, some other race alone, and 2 or more races. For median household income by the distance categories, we saw higher median household income in the farther distance categories, about 135,000. And then in the shortest distance category, on average, median income for those block groups was 85,000. So implications for this study and future studies, these findings can potentially guide local policy. Policymakers could use this information regarding hemp retail location to enact policy that increases distances between hemp retailers and schools and parks. Also, this could be used to limit the number of retailers allowed within a given neighborhood or area. The density and mapping can be used in community engagement initiatives and public health campaigns to target areas where there's a higher density or greater proximity to hemp retailers to prevent cannabis use. And also in enforcement strategies and targeting where to do compliance checks potentially. And that is the end of my, for future work, we're planning to use the new hemp licensing and cannabis licensing lists in similar work, and also link this data with outcomes. So now I'm going to turn it over to Kath to talk about the state fair.
Thank you, Natalie. Yeah, my name is Kathleen Link. I'm a senior research scientist with the Cannabis Research Center. I'm going to be talking about some surveys that we've done at the Minnesota State Fair. Next slide, please. So you may be familiar that there's a dedicated building at the Minnesota State Fair called the Driven to Discover building, and what it dedicated to University of Minnesota studies. So anyone attending the fair can visit this building and participate in one or a variety of studies that are in there. And we've had surveys there for the last several years. I'm going to be talking about our surveys that we did in 2024 and 2025. To participate in our survey, you had to be at least 18 years old. It was a quick survey, just 5 to 7 minutes, and they did it on, participants did it on computer tablets. And in 2024, we had over 1,600 participants, and then in 2025, we had over 1,800. And those are, we limited it to Minnesota residents. And just our project team, I just want to mention several people that helped in this study and the various fair surveys that we have done. Next slide, please. So you've seen this timeline a few times or something similar, and shows the different policy activities in the state. And then if you go to the next slide, Natalie, yeah, then that shows where these data that I'm going to be talking about, when they were collected. 2 fairs in 2024 and 2025. So it's after legalization of cannabis in the state. However, there were still not any dispensaries open in term, like what you're seeing now, where you can go purchase adult use cannabis. But only the hemp derived products were available in retail locations. Next. Okay, so give me an idea of the samples. And so for the people that participated in these fair surveys, I want to compare the two from 2024 and 2025, and you see that they're pretty similar. So we wanted to break out the 18 to 20-year-old group because those are those who are under the legal age to use cannabis in Minnesota. So even though it's a small group, we wanted to break those out. And then about a third in the other three age groups, and similar in the 2 years. And then next, we're going to look at gender. Again, we see fairly similar where it's in the 2 years where we're skewed a bit more female participants. And for the non-binary group, a bit fewer in the second year that we did was 2025. And then next, we're looking at race, ethnicity. And it's about 80% in both years that were non-Hispanic white, 2% non-Hispanic Black. And I want to mention that, and then you see the other categories there that are pretty similar in both years. So we did compare, I don't have the slides to show, but we did compare how these demographics on race, ethnicity, gender, and age look to the not US as a whole, but Minnesota state as a whole. They match pretty well. The one that kind of stands out as different is that we have fewer in the non-Hispanic, Black, African-American only that participating. So we don't expect these, fair people that are attending the fair and people that go to the Driven Discovery Building really to be representative of the state overall, but they do match on some of these demographics fairly well. So, next slide, please. So now I'm just going to be talking about some of the survey information that we collected related to cannabis. We have a lot of data. This is just a very small bit of the data that we collected related to cannabis. So I'm going to be talking about cannabis use in the past year and then specific types of products that people have used. So in this case, I'm going to show both the 2024 and 2025 data. So we have about half of the respondents that say they've used cannabis in the last year. It's a bit higher than you will see in other surveys across the state. In terms of specific product types, a very high use, and these are, so now we're looking at just among those who use. So in 2024, just of the 893 that have said they use cannabis, about 88% said they use edibles, and then about 2/3 for the beverages and smoke and vape categories. And 2025, we saw pretty similar breakdown of the different types. And now from here on, I'm just going to be talking about the 2025 data just to make it simpler. And I'm going to compare these data across the different demographics that we just talked about. So next slide, we're looking by age. So here, each of the colored bars is an age group. So the darker blue, the 18 to 20-year-old, and then 21 to 35, et cetera. So first you'll see that edibles was high across all the different age groups, over 80%. In the beverage category, and remember, this is all just above those who used in the last year. So these are of the users. Beverages were less likely that those were used by the underage group, the 18 to 20-year-old group, and most likely they would be using among the 21 to 35 age group. And then smoke and vape, notably that the 18 to 20-year-olds are actually the highest. If you go to the next slide, I have just what I have for those black asterisks. Those are the ones that were statistically significant. What we tested was just within each of the product type categories. So among those who smoked and vaped, were there differences across the age groups? And they were statistically significant for smoke and vape, and then also for beverages. Next, we're looking by gender. So the blue here is female, orange male, and then non-binary. Again, you'll see that edibles pretty high among all three gender groups. Beverages higher among the non-binary group. And then for the smoke and vape products, smoke and vape those who are using those, a little less among the females gender group. And then next slide will show the asterisk again. So the only ones where we saw actual statistical difference across the age groups within the product category was those who were smoking and vaping. And then lastly, we're looking across race ethnicity. So here we have the 5 race ethnicity groups that we measured. So blue, we have the non-Hispanic white only, then black only, Asian only, multi or other race, and then Hispanic is the purple. So edibles you see lower among the non-Hispanic black African American group. Beverages pretty similar across, maybe a little lower among the non-Hispanic Asian group. And smoke and vape also fairly similar, maybe a bit higher for the multi-race and Hispanic group. And then if you go to the next slide now, yeah, that just shows the only one that really where there are differences across the ages was for edibles. And there we're saying higher again among the Asian group and the non-Hispanic white, and as well as Hispanic, so not as common among the Black African American and the multi-race group. And just go to the last slide then. I just want to talk about sort of summing up what we found here. So what we see is that edible and beverage consumption was as high or higher than the smoking and vaping categories. And I want to point that out because most studies looking at cannabis use in general across the country, in different states, different populations, it's always smoking, at least smoking or smoking and vaping are the most common ways that people use. But here we're seeing that, the edibles and the beverages were higher or as high. We're thinking that's likely due to this wide availability of hemp-derived THC edibles and beverages in Minnesota. We didn't ask specifically about hemp-derived versus others, so but we are starting to look at the data a little closer and maybe try to tease out which ones are THC, hemp-derived THC based on where they purchased them. So that's some analysis that we're following up with. And then just want to note a couple other things. The edible consumption was particularly high, across all age groups and the 3 gender groups. Also pretty high among all the race ethnicity groups, but there was some differences. This may be due to the wide appeal of gummies. They're very widely available across the state, as you've seen and heard about in the previous presentations. They're very convenient, discreet. So that might be part of the reason these edible consumption is particularly high. I just want to also point out that the underage use, that 18 to 20 age group that we looked at, even though it's a small group in our sample, they were particularly high use for edibles and smoked and vape products. For something to look at for further research. So now I will turn it over to Diana.
Hello, nice to meet all of you. My name is Diana Augustin. I'm a first-year doctoral student and also a research assistant in the Cannabis Research Center, and I'll be discussing some of the qualitative work that we've participated in with our focus groups. Next slide, please. Oh, so as we discussed in the previous presentations, a lot has unfolded since the passage of the federal farm bill that has implicated Minnesota. What I want to bring forward is the role of Native American communities within this broader legalization process. So a lot of you may or may not know the first legal cannabis dispensary to open up within the borders of Minnesota happened on within Native nations. The first being the dispensary opening up on the Red Lake Nation on August 1st of 2023. So Native Care, the dispensary within the Red Lake Nation, was the first to sell recreational cannabis products within Minnesota's borders. And then a year after, we had a dispensary open up in the Prairie Island community, which was the closest place to the Twin Cities where one could purchase legal recreational cannabis. Next slide, please. So kind of situating our focus group studies, we really had a dearth within the literature of Native voices and African American voices pertaining to the role of cannabis and cannabis legislation in their lives and in their communities. And so the purpose of these studies and the study that I'm going to be talking about today is really about situating community members as the experts of their own experiences. Next slide, please. And so here are the three research questions that we had. So the first is, what is the cultural significance of cannabis and what are the norms around it? What are community perceptions regarding cannabis use within American Indian communities in Minnesota? And finally, how do members of American Indian communities in Minnesota perceive the impacts of cannabis legalization? Next slide, please. And so now I'll get into the thematic analyses that we use to code our focus group interviews. So we use a qualitative design. We focused on tribal communities within Minnesota, and the eligible participants in our focus groups were those who were aged 21 and older and identified as Native. Next slide, please. In order to recruit our sample, we engaged in a variety of recruitment methods, including posting flyers in areas where community members would be, like community centers, college campuses, cafes, grocery stores. We emailed individuals and groups in our CRC network because we had conducted one-on-one interviews prior to initiating the focus groups. So we're able to send emails to those individuals as well to see if they knew anybody in their network who was interested in participating. We also shared this information on social media, and people who are interested in participating usually would spread news of the focus groups within their own network. So word of mouth was also a recruitment method. Next slide, please. So a little bit more about the thematic analyses that we used. Ultimately, how it worked is we interviewed our participants, and then transcripts were developed. And from those transcripts, we read them over. We read for consistent patterns, and then we developed codes, which are just one words to kind of capture what that pattern is indicating. And then from there, we developed themes, and from there, we developed a code book. And you'll see a little bit more of how that looks like in the following slides. Next slide, please. So again, to kind of describe our study sample, we were able to recruit 30 community members, 15 of which were men, 14 were women, and we had one two-spirit individual within the sample. So overall, there was some gender parity. Um, the tribes represented in our sample included Dakota, Ojibwe, Diné, and Fond du Lac Grand Portage Band. All participants attended in person at a community center within Minneapolis, and we held all except one focus group, which was virtual. And the participants ranged in age from 21 to 70 years old, so we had a good distribution of ages represented, and most participants represented the Twin Cities Metro and also Greater Minnesota, as well as were enrolled in some of the local reservations. Next slide, please. So our first question, what is the cultural significance of cannabis and what are the norms? Some of the broader themes that came from this segment of the conversation was that cannabis is quite normalized and less stigmatized than before, which is a departure from kind of the older generations where cannabis was heavily kind of criminalized and associated with some negative things. Second, it was perceived as safer than alcohol and other substances. It was typically obtained from non-commercial sources. Um, and some of the quotes that kind of embody this is usually people get it from friends or families, not stores. Another person said, you have to know somebody because there's not like places where you can just buy from. And also there was a theme of cultural identity and language with the use of the term peji. And one person remarked, I always thought that peji was an Ojibwe word, which means medicine in itself. Next slide, please. So our second question, what are the community perceptions regarding cannabis use amongst American Indian communities in Minnesota? So one of the first themes we picked up on was that early exposure is common and it shapes long-term perspectives. And here I'll just read some select quotes. One person says, I started when I was 16. Before then, I thought it was stupid, but after I tried it, I've been in love ever since. Another person says, I was 12 at a friend's house. It helped me escape, made me feel better. I kept using it until I got caught by federal authorities. Still using, I feel it relaxes you and it helps you sleep. Um, Another theme was cannabis offers healing and bonding, but it brings risk, especially for youth. So this is kind of on the other side of that early exposure, is that yes, while it might be common for people to be exposed earlier, the community doesn't feel that that's a good thing. And so some people would say, you shouldn't be smoking weed with your kids. Their brains aren't developed. So there's this caution around youth exposure, especially for folks who were parents themselves. Um, a third theme is that there were generally knowledge gaps related to health and safe consumption. So some people would say, I would like to know the long-term effects, especially as a person who uses it daily. And some sub-themes included a desire for just clear information about rights and responsibilities, and then just more about related to how to protect youth from legalization and from unsafe consumption. Next slide, please. And so our final question, what are community perceptions regarding the impact of cannabis legislation? Generally, there was hope for economic opportunity. There were concerns about tribal sovereignty, especially as it relates to some conflicts between, maybe what the state of Minnesota says and what actually happens on tribal lands. There's also some concerns related to the environmental impact of cultivating cannabis, as well as some of the and the regulation, um, some of the impacts of maybe low regulatory oversight. And then another theme, desire for education and some transparency around, cannabis cultivation, and around how to safely have it if you are using it. And that's kind of embodied by this last quote. More education is needed so people don't get in trouble. Next slide, please. And so, final takeaways from our first research question, we found that cannabis is widely accepted and normalized, which is a deviation from past generations. We found that using it in private is kind of preferred over and above using in public. So participants described cannabis as safer than alcohol or other hard drugs, and most people get it through friends or informal networks rather than legal stores. And some of this is driven by cost sensitivities. Next slide, please. For the second research question, the takeaway, perceptions of cannabis are shaped by lived experiences, social networks, and observed family behavior. So participants acknowledged the benefits of medical use, but still they felt that youth exposure was a concern. And they also acknowledged that there are risks to using in general. So there's an awareness of some of the risk, but still education is very much needed across communities. Next slide, please. And for our final question, community members recognize opportunities from cannabis legalization, but they still feel uninformed. So legalization is generally seen as an opportunity for things like economic growth, for restorative justice, but there's still that challenge of balancing state and tribal jurisdiction, environmental safety, and again, the needed community education. Next slide, please. Next slide. Here's just a compilation of some of the codes for our 10th research question, which was related to hopes for legalization. You could read this. Next slide, please. And so to close, we're hoping to finalize the results for the sister study, which centered African American residents. And from there, we are hoping to continue to disseminate findings from both study arms to encourage collaboration across different sectors and to encourage using community voices to guide and inform policy decisions. Thank you so much. Next slide.
Okay, I just want to do a real quick overview of some of our dissemination. Next slide, please. We do intentional sharing through our CRC website, research briefs that you can find on our website. We'll be publishing in journals, of course, but we do a lot of dissemination through LinkedIn. So please follow us if you haven't been doing so. And we also try to get things out through the media, community talkbacks, in-person presentations and meetings. So if you haven't found us, I hope you can through one of these mechanisms to follow the research that we're doing. Next slide. And I'm not going to give you time to scan it, but you can search for the Cannabis Research Center and find our annual report. Next slide. And there's many research questions to be answered, and we're going to continue to create new data sources and draw upon expertise at the U. And so I hope that you will continue to connect with us and find value in the work that we're doing. Next slide. And at this point, we just have a few minutes for questions, but we're happy to take them.
Wonderful. Okay, so I'm going to take these in the order that I received them. One was actually answered in real time, and it was, I may have missed it, who is funding the underage purchase attempt study? And the response was it was funded by the Cannabis Research Center. The next question we have, which I think goes to Natalie, for distance to retailers, could there be comparison to grocery stores? I would assume higher income and suburban areas have more distance for everything.
Can you repeat that? What was the
For distance to retailers, could there be comparison to grocery stores?
like comparing the distance to the nearest grocery store, like comparing the distance to the nearest hemp retailer to the distance to the nearest grocery store? Is that what they're asking?
I am not sure.
I
Okay.
think if I can jump in, I think it's just any, and I think we've talked about this, probably any retailer they're closer to or have the same distance discrepancies, not just hemp retailers, any type of retailer, which grocery store. I think that's,
Yeah. Yeah. If you're living in a more rural area, you're traveling farther to the grocery store too.
Okay. The next question.
I can just say that you probably wouldn't have as many grocery stores around you, though, as you have the hemp retailers.
Yeah.
Okay, the next one for state fair surveys, the respondents are self-selected, right? It was only given to folks going into the building. So, question of how people are finding you all.
right, definitely self-selected. It's people who decide to go into the Driven to Discover building, and then also who decide to participate in a particular survey in the building. So yeah, definitely self-selected. And that's why I mentioned not expecting this to be like a representative sample of the state overall.
We're looking at multiple different types of surveys to get estimates of the prevalence of use in different products. The state fair just gives us one source of data, and we have to acknowledge the limitations that it comes with.
Thanks, Tracy.
Okay, the next one. Does the CRC have a newsletter?
We just started developing newsletter. We've had one round. If you go to our website, I believe I have the person who is in charge of that is not with us. She's out of the country right now. But if you contact the Cannabis Research Center and say you want to receive the newsletter, you can get on our list, and we'll be happy to send it to future ones to you.
Awesome. Okay. Is there a legal reason for using pseudo underage purchasers instead of actual underage purchasers?
Yeah, that's a really good question. So, we're not law enforcement and we can't break the law. And so we have to make sure that the people that we're hiring are actually of age, and that we're telling the truth the whole time. That's our Office of General Counsel requires that. And then also just um, this is, for research, not for like anything punitive. And so there are actual compliance checks that use real underage people. We have to simulate that. So we have to use pseudo underage people. And I think the next question is for me too. Online sales were not included, correct? That's correct. We have not looked at online sales of hemp-derived THC products. It's really something that people have brought up that I think we're interested in like thinking about. The practice of that is a lot more challenging than just like hiring people and sending them out in some ways. So we've thought about that, but we have not yet started that. So this was only like retail locations in Hennepin and Ramsey County.
And Eileen, the next one might
Yeah, I
be for
see
you
that too.
too.
Okay.
We'll do one
How
more.
do this, yeah, how do the pseudo underage sale results for cannabis compare to alcohol? So we have done pseudo underage purchase attempts of alcohol for several years. I think the last time we did it was in 2023, and the alcohol sales rate was much lower than what we have seen for cannabis, or at least what we had seen in this study. The last time we did it, it was a pretty pilot study. It was relatively small. And I believe the sales rate was somewhere under 20%. So lower than what we've
Little
seen.
high,
Yes, it
little
was
higher.
higher than that, Tracy. Okay. Do you remember what it was, Tracy?
More around 25%, I would say.
Okay.
And I'll say
Yeah.
that just a little history, when we first started doing pseudo underage purchase attempts, it was like 75 to 100% with alcohol because of regular compliance checks and coalitions and cities and counties paying attention. We saw the drop in the likelihood of illegal sales for underage. Just one quick thing, and we looked at dispensaries in California, just seeing if pseudo underage people could enter. There was 100% compliance, but they have security at the door checking IDs.
Oh, interesting. Well, I'm gonna, since we're at time, I'll wrap us up. If there are questions that kind of come in through the chat after we close, I will certainly pass those along. A huge thank you to our presenters for sharing their time and research with us. Thank you to all of you who joined today, and really thank you for attending the webinar. I'm gonna pop a webinar survey in the chat. Please take a minute to fill out this feedback form. It really helps us inform future webinar topics and researchers to make sure they're relevant and timely. You'll also see an email from us with all sorts of information, including perhaps a link to the CRC newsletter. Find them on LinkedIn. We'll look to get you connected, and please reach out at any time. Thank you all.